Okay, I think we're good to go. I've just had a signal. So good morning, ladies and gentlemen. Welcome to this webinar on the results of the CCN research into the proposed changes on adult social care. This morning, this webinar, by the way, is being recorded. So be aware that effectively by joining this, you are consenting to being recorded. My name is Martin Tett. I'm the spokesman for the County Councils Network on Health and Adult Social Care. I will be your chairman today for this event. I'm joined by an illustrious panel, I have to say. So we have Danny Sperrin from Newton, we have Nadra Ahmed, and we also have Rachel Shimon. I'll say a little bit more about each of the participants as we get to them. But if I can say just a few words up front. Last year, some of the work that was done by CCN published research with Newton, and we looked at how the optimized model of social care could operate. And that was pretty well received across the entire sector. Since then, obviously, most people will be aware that the government have published a lot of proposals in terms of the way that they propose to change the sector. And that's received a fair amount of comment. One of the things we wanted to do was look at the way that that would actually operate in practice across the entire sector. And we partnered not just as the network for counties and unitaries, but also with other local authorities, with the LGA, and in particular with care providers, and also with residents to actually look at the way in which care users see this particular set of changes. And we've done a lot of modelling, and we're going to be presenting the findings of that modelling this morning. What's very important is that we all support, I think, the objective of the changes that are proposed in total across the adult social care sector. It's been a bit of a forgotten orphan for too long in local government and in the care sector. So I think the objective of the government's changes are well received. However, they'll only be achieved if in fact the changes are implemented effectively. One of the things that we're well aware of is that actually they need to work as a government very closely with the sector. And what we've been doing is gathering evidence that we hope will actually show whether or not the government's proposals are robust and whether they can actually be implemented successfully. And you'll see some of the results on that this morning. What we've done as an organisation is partnered with Newton, who are very well respected within this particular profession. And they've done an analysis to understand the implementation challenges and the steps that both local and national government will need to take in order to make these changes a success. Now, most of you will be aware that in March, we actually published a study that was well received, showing the impact on local authorities, in particular of activating what's called Section 18.3 and introducing something called the fair cost of care. And you'll hear a lot more about that this morning. Effectively, what that does is it gives self-funders, those who are paying for their own care, the ability to access the rate that local councils have for self-funding, for their own funding rather, and the fair cost of care is the hypothecated rate effectively that councils will then have to pay. Now, today's report moves on from that original work that we did, and it marries that evidence with a more extensive study where we've actually combined the impact of the full range of those charging reforms outlined in the white paper, including the extended means test, so you could have a lot more assets before you actually have to start contributing. And also the cap on care that's now been raised or proposed to be raised to £86,000. And we've also injected into it a really good look at the operational aspects and the workforce challenges that will be required to implement these proposals over the next 18 months. So there's a lot of work, both in terms of what proposals actually are, the way in which they'll impact financially, but also really importantly, we've looked at the operational aspects of it to see whether they are actually implementable in practice on the ground. Now, what we've done, as I said at the beginning, is we've developed this through extensive engagement with other local authorities, with providers and residents. And very importantly, what we've done, and I'm not sure anybody else has actually undertaken this yet, is go right down to postcode level to understand the impact of these reforms right across the country. So financially, we've come to some fairly stark conclusions on this. Now, the detailed analysis, and you'll hear this from Danny in a minute, suggests that at the lower end, the cost of the reforms could be at least £10 billion higher than the government estimates over the next decade, £10 billion. That's a really big gap. However, using postcode lottery, postcode level wealth and asset data, we can actually go much further down and look at the financial impact right down to county level. And what we find is that the impact of those financial pressures is not distributed equally. And in fact, they fall far more heavily on the local authorities in the south, the east and the southwest of the country. And again, you'll hear more about why that is the case in the work that Danny will be presenting. They are very stark readings, and what's very important is that we now engage with government to make sure that actually these findings are communicated, discussed with government, and hopefully we can find a path forward in partnership with the government. I mentioned just now the operational aspects of this, and one of the things I'm very aware of as a council leader is it will only work if you've actually got the people to implement the reforms that the government is talking about. And one of the starkest conclusions we've come to is at the moment, we just don't have the trained staff that are going to be required to implement these proposals, certainly not in the next 12 to 24 months. And again, you'll hear a lot more about the scale of that challenge in terms of the trained workforce we're going to need to carry out the assessments, and particularly the financial assessments that are included in this piece of work. So that's a brief summary in terms of what we've done, why we've done it, and some of the headline conclusions. But much more importantly, now let me hand you over to the real experts who are going to take you through this work. So firstly, I'm going to hand over to Danny. Danny Sperrin is the director at Newton who's been carrying out this research, and he's going to give you an in-depth summary of what the scale of the challenges are and some of those recommendations. So Danny, can I hand straight over to you now?
Thanks very much, Martin, and thank you to everyone who's been involved in this piece of work on behalf of the Newton team, particularly those colleagues who've been part of the steering group. I think their support and commitment to this piece of work has been brilliant, and it's been a real privilege for Newton to play our role within that. If you could just move to the next slide. I'm just going to talk for around 20 minutes through some of the key findings of the work. And we're going to begin just with an overview of the context and approach, move through then some more of the detail in terms of the methodology and the findings, including some of that important feedback from CCM member councils before coming to some of the key recommendations being made by this work. So if you take us, thank you. So in terms of, and really probably just reiterating Martin's introduction, what we've sought to do through this work is to look at really 4 key questions initially. So what will the financial and operational impact be of implementing the £86,000 cap on care costs? What will the operational financial impact be of the new, more generous means test system? What will the impact of the fair cost of care be? And to be clear on that, we've used the good work already done in partnership with CCM by Lyme Breeson. And then lastly, looking at the change in demand for local authority assessment and support, so the additional workload brought about both by having more people means tested and supported by the local authority, but also by the implementation of Section 18.3, where those that pay for their own care can ask the local authority to broker that for them. As well as understanding the operational and financial impact of all of those things, we've also taken the views of care providers and residents to seek to understand the impact on them. But then importantly, we've moved to exploring what can be done, both in terms of additional support required centrally, but also what can be done locally to set up for successful implementation. So in terms of the approach to this work, two main pieces. The first being just extensive engagement. And again, we reiterate our thanks to everyone who's been involved in this. I think over the course of 10 different roundtables, including with directors of social care, chief executives, finance directors, residents, carers, families, small, medium and large sized care providers as well. I think we've spoken to over 100 different people throughout that to really try to grasp the full range of issues and implications of this reform. That is hopefully then complemented by a robust evidence base. So Martin has already briefly introduced the kind of granular data we've been able to use for this, but also bringing that together with evidence from our experience of working with a number of different local authorities over the years to help to understand some of those really practical implications on the ground. If we move to the next page, so our steering group has been headed by Martin, as you will know, and has real expert coverage through its membership. And we have a great range of backgrounds covering we think all the major stakeholder groups who are impacted by this. We've also collaborated with the Local Government Association, ADAS, National Care Association, Care England and Health Watch, again, really seeking to understand as broad a range of views as we can and to build on the good work that is already being done across the sector to help to understand some of the impacts of charging reform and think about how we can best support implementation. So I'm just going to now speak briefly about the methodology that's gone into some of the analysis in this work. It will only be brief, but it's clearly explained in lots more detail in the report. You just click on one. So the main, or one of the main inputs to this is as we've said previously, that kind of granular wealth and assets data for all of our population, which has been supplied by CACI. This data has been analysed, adjusted, and then adjusted to draw out the care population within that, and also to only look at chargeable assets, which includes estimating how frequently the house is taken into account when assessing somebody's wealth in order for them to be means tested for social care. In terms of working age adults, we've carried out exactly the same analysis, which concluded that we find a very, very significant majority, as many on this call will already know, already being fully funded. And as such, we sort of formed the view quite quickly that the government's impact assessment around this feels to be a conservative estimate. And so we haven't sort of sought to build on that through doing this work. So most of what you see from here on is referring to the older adults, 65 plus population only. There's clearly uncertainty in this. I think it's important to stress that we present a lower and an upper scenario to hopefully indicate, a range of possibilities. There are a number of key assumptions that go into developing this analysis, and those should be looked at and tested locally to build a richer understanding. What we hope is that this provides a helpful starting point or sort of build on what's been done so far, but absolutely welcome the opportunity to continue to work with colleagues from across the sector to build on the quality and accuracy of everything used. And just to that end, I think we've had constructive conversations with the Department of Health and Social Care throughout, particularly when comparing to their existing impact assessment. So the analysis shown on the page here is what the estimated chargeable asset distribution is for all of the older adult care population. And this really provides the basis then for estimating the incremental cost of the means test, of the new, more generous means test, the incremental cost of the introducing the £86,000 cap, and that then provides a basis for modelling some of the operational implications as well. So in summary, sorry, just go back one more page for me, just back to that one. Thank you. In summary, we estimate what we're really looking at in particular is that 25% of people who we estimate as between 23.25 and £100,000 worth of assets, and that 10% of people who exist in the 100,000 plus. Those are the groups who are currently completely self-funded. That 25% will come fully into the new means test, and with them clearly bring a requirement for additional financial support from the local authority, as well as additional operational workload to manage those people as part of our caseloads. The 10% with over £100,000, they will, again, with the option to meter towards the £86,000 cap and the option to ask the local authority to broker care on their behalf. Again, they may represent may represent additional cost and operational implication. You can just move on now. We'll dive a little bit more into the operational impact brought about by this. You can see some of the key figures on the screen here. Through the analysis in this report, we're estimating that approximately, and of course this is approximate, but just over 100,000 additional Care Act assessments will be required to be carried out each year. Importantly, and referring back to that 25% group who will fall into the means test in the future, it's not just about assessments, particularly for that cohort. And so what we seek to do through this work is to estimate the full kind of case management activity that would come along with that. And that's how we get to the quite stark finding that we estimate we require an additional 4,300 social workers in order to manage that existing demand, manage that additional demand. Important to stress that this assumes that our operating models don't change and that we continue to work with people in the same way, the same level of intensity as we have done up to this point. But again, important to stress that this comes on the basis of close to 1,800 existing vacancies in our existing workforce of around 17,000 social workers. So represents a real and significant workforce pressure that I think many authorities are beginning to feel some real concern about. We also have just less than 100,000 additional financial assessments, and again through estimating how the sort of workload associated with those, we think approximately 700 or more financial assessment officers. And I think these are a group who it is easy to forget about within some of this wider analysis, and I think is again reflecting feedback from our colleagues in local authorities. That's a number that's really quite scary, and I think understanding financial assessment officers are a very specialist role, and one that I think we find difficult to recruit to. So that gives us the total operational impact, and apologies now to throw an awful lot of numbers onto the page. Obviously these are all presented in more detail through the main report, but what we seek to do here is to provide a summary of what this all means financially. And what we show here in the two tables is our estimate of the lower and the upper case. First thing to say, numbers are shown over a 10-year period, include inflation, but are discounted to 2020. Reason for that is to align with the impact assessment figures so we can make a more direct comparison. It is the impact assessment figures we include for working age adults here, and it's the Langruisen fair cost of care figures as previously mentioned. So you can see there in terms of our total financial impact, we're estimating somewhere between 29 and 32 billion cumulatively over that 10-year period, compared to around 19 to 20 billion from the impact assessment. I think two really important things to draw out here. The first is in terms of explaining the method, and if you look through the means test line, you'll see the first 4 or 5 years ramping up the cost there based on the average duration that somebody spends in a care package, and then a much slower ramp up as people gradually hit the cap over time. One very important point perhaps to draw attention to is the sort of steady state per year figures, which indicate that we social care will be requiring close to 50% of the national insurance levy, which is the £12 billion per year. You see those figures sort of between 5.5 and 6 billion as we get towards the latter part of this profile. Just to emphasize as well, this analysis does not have demand growth built in. We've deliberately kept that separately. So that gives the total financial implication. Just to draw out on the next slide, the key differences to the impact assessment that has already been completed. In terms of our lower case, it's worth emphasising that in terms of the analysis of the older adults means test and cap, we're not actually a million miles away from what the impact assessment has already estimated. And I should emphasise again, we've used different input data, a different methodology, and some key assumptions are varied as well. However, there is clearly a significant overall difference. We do estimate a larger overall cost of the means test and cap, and more of that being on the means test than the cap, which all of that means that cost is recognised slightly earlier, which gives that sort of slightly faster increase in cost year to year. Another key difference, the fair cost of care suggests a higher cost than the original impact analysis, and that again is based on the good work done by Langruisen. And then lastly, in terms of the operational analysis, we estimate a greater workforce requirement and therefore an associated cost. So those are some of the key differences. Again, more of that is explained in some detail in the report. The last bits in terms of the analysis, just to draw out some of the regional distribution, which you can see sort of shown again here on the screen, and again is summarised in the report. Again, reinforcing Martin's point, we do see the most significant financial impact in those areas of the country that have greater numbers of people, in those who remember back to the graph a few slides ago, greater numbers of people in those sort of £23,250 worth of assets and upwards. Is where we see the most significant financial impact. And if we just click on one more, correspondingly, we see therefore that is driven majority or a significant majority through county councils. So that's the sort of brief run through the numbers. And again, I appreciate there's an awful lot of detail in there, and would encourage people to sort of explore that in more detail through the report. In terms of the, we gathered some very considerable feedback from CCN member local authorities on this. And I think it's fair to say, in summary, the vast majority, as you can see on the left-hand side of the screen now, are incredibly supportive of what we're trying to achieve through these reforms. However, I think if you look to the right-hand side, I think there's a real concern around how well understood this is and how well prepared people feel. So 25% of people felt they understand reforms very well, and 63% said they felt not well prepared. If we move on to the next page, we'll see some of the specific things that councils feel worried about. Clearly, finding the right funding is a major concern. And I'm sure many will share this view, having seen some of the figures presented here in terms of recruiting those additional, 5,000 staff in total. I think what that leads to then over on the right-hand side is some real support for phasing or delaying key aspects in order to provide time to fully prepare. In terms then of recommendations, I think we clearly, I say a big part of this work is carrying out the analysis, but the recommendations really focus on what's required to make a success of this, as I say, which is something, these reforms are something which has broad-based support from the members surveyed. The point, we've broken these into two halves. So the first section is recommendations for central policymakers, in terms of additional support we require from central government. The second part is a section on recommendations for local authorities and local systems, recognising that there's a role, clearly an important role for both to play to make successful implementation. I would argue more stark than the financial figures are those workforce requirements, and that's why our sort of first key recommendation is the urgent investment in a national recruitment and workforce development campaign. I think, again, we recognise that those 4,300 social workers simply don't exist today, and therefore we need to think quite radically about how and where we recruit and develop some of the people to do that work. Clearly, point two, these need to be fully funded. I think that argument's been made strongly throughout, and hopefully this report offers some idea to some thought on what the total cost may be. Point three, around phasing, you've seen that strongly come through from the survey of CCN members. I think in a lot of ways this is very strongly linked to the requirement for workforce. I think if we take the funding to one side, we are either going to have to do, as I said, do something quite radical in terms of recruitment and workforce development, or local authorities are going to have to, again, quite radically transform their operations in order to be able to cope with that additional demand without requiring the additional staff. Both of those things clearly take significant time, and I think is a big driver of the argument to delay or to phase some key components of this. I think a number of local authorities that we've spoken to are anxious about finding the significant project and change management skills and capability required to manage what is an extensive change programme, and so more support required there from central government to make that happen. And then point five, which we perhaps haven't touched on particularly thoroughly here, is to say what we often find, and I know a number of county authorities who are struggling with appropriate home care and community capacity, which can result in people unnecessarily finding their way into residential and nursing beds. So this provides growing that capacity would provide an opportunity to limit that and provide a very the right and appropriate alternative. We move on to the next page. Thank you. Many of you will remember the Future of Adult Social Care report done jointly between ourselves and CCN last year. There are a number of recommendations in that which seek to support local authorities to continue to manage demand and continue to sort of optimise their local delivery. And so there's a number of asks for support from central government within that, which again would acting on all of at this stage would support with some of the very real additional cost and workforce requirement brought about by charging reforms. We've given a hint in terms of the distribution regionally. We know that funding needs to be made available in line with the local need. And then moving on to point 8, I think in terms of additional cost outside of that will be borne by local authorities, if we do see the implementation of a fair cost of care, a lack of ability to cross-subsidise in the market, we expect that may well drive pressure into CHC rates, which could drive cost up there to the NHS. That's not something we've sought to put a number on through this report, but it's certainly something that we believe needs to be fully explored and accounted for. I think it's fair to say through our conversations with residents and local authorities and providers, it's unclear how those currently receiving services will transition into the new system. And I think we need additional guidance around that. And then point 10, and perhaps almost one of the most important overall, we recognise from our conversations with residents throughout this work, residents are confused by the implications of all of this for them and how they will interact with the new system. On the local authority side, there's significant concern that will translate into additional demands of queries and complaints and requests for clarification. And so we need to really think about a centrally coordinated communications effort to make some of the implications of this to residents and their families really clear. Just the last section of this presentation then to reflect on some of the recommendations for local systems. Again, recognising that locally and centrally both clearly have a major role to play, and picking up really where we left off on the previous page. So it needs to be developed, and a communication and engagement plan for residents needs to be developed in partnership locally and centrally. And again, just emphasising that point on the kind of widespread lack of clarity, misunderstanding about the scope and the impact that this will have on individuals. Points 2 and 3 really suggest that local authorities to continue, and many have been working on this for many years, but to continue efforts to promote independence, maximise the effective and appropriate use of community resources, to avoid and prevent need escalating to the point where someone needs residential care when the majority of these costs will be borne. And also to continue to look at the productivity of the workforce, and including exploring what could be done digitally and through use of technology. Back to the point around the 4,300 social workers, we know that those people are not readily available. And point 4 really summarises some of that, I suppose, to say, recognising again we can't go out and recruit those people. What do we need to do differently in terms of how we manage our demand, and taking a tailored approach, recognising digital self-assessment tools may have a role to play within that. Leveraging lesser qualified staff may also have a role in that, but that needs to be done quite cautiously and carefully so as to not result in drawing more demand into the system. Just move on to the final page, thanks. There are clearly major systems implications of this, not least administering a personal care account and the potential for digital self-assessment tools. So colleagues in IT and digital need to be really closely engaged in all of this. We touched on in the previous set of recommendations the lack of home care capacity and how that can be driving some additional demand into residential and nursing care. So again, continuing to work through local plans to do everything we can to maximise capacity there will be helpful in terms of potentially mitigating some of this additional cost. I think it's fair to say, and we'll hear from Nigel later on, I think it's fair to say that providers are anxious and feel in the dark about all of this. And I think, again, local authorities continuing to do all they can to develop an open and two-way dialogue, specifically around the fair cost of care, must continue. Engaging colleagues from the NHS, particularly through ICSs, to ensure that both those partners understand the impact of reform. We need to understand the interaction between existing discharge to assess guidance, for example, but also to look for local support and consider how partnerships could support potentially with, for example, the workforce challenges. And then lastly, and recognising again, that this comes in the context of a huge program of change within local authorities and within adult social care, but wherever possible, prioritising scarce change resource to support implementation of, I say, what is an extensive change programme. That's pretty much everything from me. Just the last point to say in terms of things that will happen next. There'll be an opportunity to request some summary, a summary of some of this analysis at a local level. If you use the QR code or contact separately afterwards. There will also be more detailed briefings and workshops being carried out over the coming weeks to help disseminate all of the work done here. And as I say, trying to turn this to something that can be as valuable and useful locally as possible. At that point, I will hand back to Martin.
Danny, thank you very much indeed for a very comprehensive summary of the quite major changes that are proposed and their impact, not just on local government, but actually right across the care sector. And I think they are quite profound. Obviously, we're seeing here from your research that the more generous means test will mean there are more people who qualify for local government support. The cap on care costs, again, would increase pressure financially on councils. The fair cost of care could well mean that we're paying higher rates for that care. And Section 18.3, that's the ability of self-funders to access the system, will mean significantly more people able to come into local government support. But also one of the key conclusions you've just been highlighting again is the extra assessments. That's going to mean the enormous pressure it's going to mean on resources. And I'm sure that's something that some of my colleagues in a moment will want to talk about, just simply how we would find the people to do the amount of assessments that are being proposed effectively through these changes. But let's hear a little bit more now from some of the people who actually provide the care. And what I'm delighted is that we've actually got Nadra Ahmed, who's chair of the National Care Association, Nadra OBE. Can I hand over to you, Nadra, to give us a perspective from the provider's perspective?
Thank you very much, Martin, and thank you, Danny, for that gallop through of what has been a huge piece of work, and we've been privileged to be able to be part of that. So thank you very much from the provider perspective. And we represent small to medium-sized providers. I think it's really important to say that the need for reform in social care is long overdue. We all know that, and so we welcome the intent of where we want to be. It's the how we get there that remains the challenge. For a sector that's been much neglected, what we must be sure about is that any reform is in the best interest of those who we care for, but it's also got to be sustainable. And I think what that leads to is a point that Danny's already made, that it needs to be fully funded. And that's the challenge that we will face as we go forward. What this report actually highlights is some of the real gaps when it comes to that making it sustainable. Because unless and until we can be confident that this will be fully funded, the impact of it will be felt in a very negative way across those who are trying to make sure they deliver it. If we look at this report and take from it the fact that there is a significant underestimation of the need to make it work, then we all face some real questions about how it will work. If you consistently look at the workforce issue, how are we going to get the people in to do all those extra assessments? How will that all work? And if there are so many questions about, we already have a workforce shortage. So when we're looking at the local authority staff who will need to be in place to do all those assessments, we've got to make sure that that could happen. The regional variations will also create some tensions, and we need to understand some of that as well. And I just wonder, when we're a sector that's already facing enormous, so from my part of the world, we've got substantial frontline staffing crisis, and we know that goes alongside funding. And if we and part of our income will need to be looked at. in this, as we look at 100,000 extra assessments that might come their way, people who quite rightly want to go down the route of being assessed, we've got to look at where the fees might be set and how that's going to impact on the businesses that we run, which are smaller businesses and larger ones. It will have an impact on all of this. I think it does cause some real concern for providers, because we will be sort of done unto. We're not in the mix of being able to lead the change, but we're the ones who will be most affected by it, or the people that come into our services will be affected by this. And I think one of the most important messages from me would be that all local authorities across the country need to be very clear about how they're working with providers. That communication strategy is going to be key in all of this, because if we don't get the messaging right, what I've said, and I've said this in some of the steering group meetings as well, is I don't, as the provider, want to be faced with all the questions, because we won't have all the answers. So there is going to have to be a system that's set up that will enable families and the people who use our services to be able to ask those questions about how that assessment might work and what the impact might be. So when we look at this, we've got to be absolutely clear we're all in it together. Some people it will affect much more, but we as the provider sector will be impacted by this. So there is a real desire for us to be working with our local authorities to make sure that we can get the right messages across and do what we can to support. We can't give financial advice to anybody as providers, and I think that needs to be remembered. We can only pass that information on. I think the other point I just wanted to raise was, from reading this report and living through the challenges of social care for the last 4 decades, the underfunding of local authorities has a direct impact on our sector, and a direct impact. So we can sit in rooms with you and have debates about the fees. We can have all sorts of debates, and you can tell us that you haven't got the money to do it. And we can get central government telling us actually they've got the money to do it. And I know I read something actually only yesterday that said there's plenty of money in the system to be supporting the sector. So working alongside people like Rachel and Martin, we get a different kind of story around this. But there is no doubt the only person that loses out will be a service user potentially. And I think that's, these assessments take loads of time. There's also the care reviews that have to take place, the backdrop of all of this that goes on, which, we will lose out on if we're not careful, if the funding isn't right. And for me, the biggest challenge is that we consistently raise expectations. So the individual, the public out there, the expectations are raised as to how this will help them, and they won't have to sell their house or whatever that might be. But the reality has to be reflected properly so that we're not all fighting fire here and underfunded to do that, because there's a lot of pressure in our roles, as we know, whether you're a provider or whether you're working in the local authority, in the social work, whether you're a social worker going out to do the assessments, whether you're a care manager sitting in a hospital setting, that pressure is enormous. So if we don't have the right information and we're raising people's expectations only for them to be let down, then that creates an awful lot of tension. Reform should make things better. I mean, that's what we've been calling for. That's what reform is there for. It should make things better. And it should not be placed in a way that's on a wing and a prayer. And if that's the way it goes, then we actually all fail, and we fail the people that we want to support. If the funding isn't available, and I think it's really interesting to hear, how much of the levy we would need really to make this realistic, and how much are we actually going to get is a bit of a joke, but we won't go into that. If funding isn't available to make this happen, then we're going to fall at the first hurdle. And I think that, for me, is the messaging that comes out. take your time, get it ready, work through what we've got to do, make sure we've got the workforce, make sure we've got the funding, make sure people know what to expect, and then let's take that step. But if we're not anywhere near that, then I think the challenge could be insurmountable. Thank you.
Nadja, thank you very much indeed for that. Really important to hear from the provider perspective. Just before I hand over to Rachel, can I just say two things? First of all of the slides from Danny's excellent presentation will be on the County Councils Network website straight after this. So you'll be able to see those. And obviously, I would also recommend that you have a look through the report. There's an enormous amount of detail that supplements the presentation you've seen within that report. The other thing is we're already, this is a heads up to Danny actually, we're getting some questions through already about how we captured the staffing numbers and have we adequately covered off some of the other back office staff that support the assessors to make sure that, if you like, we've captured all of the people needed rather than just, if you like, the headline staff. So I'll ask that question to you, Danny, when we get into the Q&A in a little bit. So you've got a little bit of warning there. Can I now introduce Rachel Shimmin? Rachel Shimmin is the Health and Social Care Advisor to the Association of Chief Executives. She also has the distinct pleasure of being the Chief Executive for Buckinghamshire County Council. I'd like to hand over to you now, Rachel.
Thanks, Martin. And hello, everybody, because I was looking down the participant list and there are loads of names there I recognise. So it's lovely to know that you're on the call, even if I can't see you. Lots of people on this call, including the presenters, have been really involved in the world of public service for many years. And we all know that this is one of the biggest changes we've ever faced in relation to adult care. And as Nadja and Martin have both said, we're really pleased that there's going to be some reform because we know we've had lots of perverse financial arrangements and difficult situations for many years. But I wanted just to share with you in my segment today a few observations from a chief exec's perspective. The first, obviously, is going to be around the money, because in order to make anything work in public service or anywhere else in life, you've got to be able to afford to do it. So the financial underpinning for this reform is absolutely critical. And the work we've done with Newton, and can I just say that I think the model of working collectively with providers of services, councils, both in their role as commissioners, but also in conveners of place, colleagues within the NHS and most importantly service users, is a really good solid model. I think the choir of voices that we create is much more effective when we start lobbying government, and it's been great to have Nadja and also Martin Green, who's been involved in this piece of work. So on the money, we know from the projections here, and Danny can talk us through in the Q&A the detail of that, and do keep your questions coming in, by the way. People start to generate them. There's nothing surer than somebody else is thinking the same thing, so I'll put it in the chat. We know that the financial projections in relation to the cost of these reforms have been undercooked. We know they have, and this work is really important because it gives us the evidence base around that. Now, what I would ask people to start thinking about on this call is talk to your leaders, talk to your chief execs, talk to your partners in the NHS, talk to your partners in the provider world, and make sure that you are reflecting back into government issues of concern. If you have them, I have them, definitely have them, in relation to the pace of the reforms and also the funding of reforms. Now, Nadja's observation is a really interesting one, because I've heard that too. Actually, there's plenty of money in relation to social care. Well, there isn't. We know there isn't. There absolutely is not plenty of money in relation to social care. And our backdrop collectively across the country is that we're facing unprecedented levels of demand, both in relation to adult services, in relation to hospital discharge, in relation to deprivation of liberty, in relation to transitions, in relation to children's services. Now, those are just the people-based services. And of course, councils have got much wider statutory responsibilities that they have to fund. And I'm afraid I just can't subscribe to the view that says there's plenty of money in the system, you all just need to go away and find a way of making it work. Now, finding a way to make things work is what we all do. You know, that's what we all do day in, day out. But there is absolutely an issue, in my view, and I've been saying this consistently to civil servants and politicians and partners, around the funding gap between what we want to achieve in these reforms and the money that is available. I guess what I'm fairly nervous about in terms of the money is the proposition of councils being left with actually you're going to have to do this and somehow you're going to have to find the money to do it, because we all know the cycle that councils go through in terms of council tax setting and how difficult that is. We also know that there's a real cost of living issue for people who live in our communities, and therefore for us in local government, there is ultimately, isn't there, always a finite amount of money, even if council tax is increased, and that finite amount of money never quite keep pace with demand. So the hard choices that we're going to face if we are underfunded for these reforms, I don't think can be underestimated, particularly in relation to the impact on a broader group of people and their day-to-day lives and the services actually that they pay for through both council tax and other forms of taxation. Secondly, I am really worried about the operational impact, and I think, as people have said in the chat bar, that isn't just social workers, it's a whole series of colleagues that are needed at the coalface to make these reforms right. I think we're going to have to rethink our model actually in relation to how we do social work, both for adults and for children, because we just are not keeping pace with the volume of work compared to the number of qualified staff. And that's an issue that we need to talk to government about, we need to talk to the regulator about, so that we're all setting off on a journey together where we're going to do something that is achievable and right for the end person who uses these services, and we're not setting any of us up to fail. Because that backlog issue, that combination of the backlog issue, the reforms in this area of the world, and also other reforms that are in the offing for local government and public services more broadly, needs to be considered together. And we need as simple as possible a plan as we can to get from A to B. The recruitment of the workforce in the way Danny set out, I think is going to be nigh on impossible, and we will automate wherever we can. But we also know that with groups of people who use services, it's not all right just to automate everything and hope for the best. You know, there is absolutely a human element to the way that work is developed. I think it's right that we call for a phasing in the implementation of these reforms. We've got to do it properly. We don't want to do this on the back of a fag packet. We don't want to do this in a way that makes it worse for anybody, whether that's a provider, a group of service users, a council's budget, our own workforce, who are tired, frankly, and will feel really disillusioned if they start to fail at the biggest area of reform we've faced in decades. So we do need time to think it through properly, understand how we're going to resource it, get the right people in place doing the right jobs in the right way, and have that communication strategy Nadia talked about that's so critical in terms of our local provider market. We have got strategies also, of course, in place in relation to broader promotion of independence and maximising community assets. And that's an important part of the story in terms of people living well for longer, as independently as they possibly can. And that also takes bandwidth, it takes resource, and it takes people to do the doing. All of that takes time. And I guess finally for me, what do the reforms mean for our residents and our users of services? So my sense is that people don't really understand them. Why would you? It's actually devilishly complicated. I think that there is a sense that this somehow is now fixed and it's all going to be fine. And I think it's really complicated. And I think collectively we're going to have a really difficult job messaging the but. Well, I thought I didn't have to sell my house. Well, but actually there's a bit of an issue there. So we will need to work with government and our colleagues in the provider world on as simple a messaging as possible. And one of the things I've heard, and is absolutely sensible, is we have one set of communications on this stuff that we use nationally, that the language is simple, that we make it really easy to understand, because I think people are going to have some expectations that we need to manage as we move forward. And sadly, I do think that we're going to have to deal with more disputes on issues in connection with things like, you know, when did the meter start? have I really metered towards the cap in the way you say I have? Do you really think my needs are not as high as I think they are? You know, so I do think we'll have all of those issues. And of course, we've got to work really closely with our communities of interest and our communities in general to make sure those issues are well understood. So if we don't fund properly, and if we don't have time to plan properly, if we don't have an acceptance that the workforce as it stands is not sufficient to deliver these reforms will not land in the way they were intended. If we are able to negotiate using this and other evidence bases with government on actually we do want to deliver these reforms, absolutely we want to get into this space, but we need time and resource to do it properly, I think these reforms could be really helpful for generations to come. Thanks, and look forward to the questions. Back to you, Martin.
Yeah, thanks a lot, Rachel. And I think you made some really good points there. There's quite a few questions coming in around the messaging to the public, which you mentioned just at the end there. I'm an elected politician, but I've got real concern about the way this is going to land with the public. The messaging out there is very much that this is fixing social care. It's gone as an issue. And I think lots of people would just think they can turn up at the local council and get almost whatever they want from social care now. And that is clearly not the case. And I'm also worried about the messaging to members of parliament, because a lot of our communication is with members of parliament who raise cases on behalf of their constituents. And again, I think lots of MPs are being told it's all fixed. And we're going to be going back with some quite hard messages saying, no, it's not. We all know for the first 3 years, that 12 billion that's being raised from the national insurance increase is going overwhelmingly to the National Health Service. We're getting crumbs from the table for the next 3 years. And yet these reforms come in towards the end of next year. So again, that funding is not yet fully in place in anything like the scale that this research is showing it has to be. So I think there's some really big issues building up there. So I'm sure we'll come back to those. I've got my last speaker, and then I'm going to move to the Q&A slot. And hopefully, Richard available now? I know Richard had, you are there, Richard. I know you had another appointment you had to go to just before this. So Richard is the Corporate Director for Health and Adult Services at North Yorkshire Council. And Richard, do you want to give us a perspective again from the local government point of view? Over to you.
Yes, thank you very much, Martin, and good to be here today and to have been part of this work too. And I think you'll see a good deal of consensus between all of the speakers today. And first of all, I'd like to start by welcoming this report. It's been a really good piece of work. Huge thanks to both CCN and Newton and all the colleagues, people who use services, providers, councils and beyond who've taken part of this. And this is very much intended to be part of a constructive conversation with government. And I think you've heard that from the other speakers. And I would say it's been co-produced with a broad range of people and lots of different voices. It includes people from counties, yes, and it also includes people from more urban areas. So it's a very rounded view. And the other thing I would say is it's not an abstract policy issue. It's about all of us as sons, daughters, mums, dads, siblings, friends, part of the community. We all have a stake in this, whatever our different roles and perspectives. And let's be honest, although this report raises major concerns about the detail of and the funding for these reforms, the starting point for many of us has been to welcome the fact that the government actually is preparing to have a serious attempt at reform. And it is one of the key issues in social care today, that issue of the certainty of cost for individuals and families. And you can also see from this report that there is actually, if you look at the percentages, overwhelming support for most of the key principles in the reforms. As ever, the devil is in the detail, and our concerns are about how we land them, and especially, as you've heard, about how they are funded. We all know that the current system has unpredictable and in some cases catastrophic cost implications for people, and a high degree of unfairness and cross-subsidy. And that's difficult if you're a member of the public, it's difficult if you're a care provider, it's complicated if you're a council too. And I guess for me, one of the big tests of reform will be whether these changes create greater certainty and greater equity, or whether actually they add new unintended consequences. And we need to give that a bit of thought and work through the detail. And certainly also within my own council here in North Yorkshire, members have always been clear that reforms about charging need to be twin-tracked with reform and stabilisation of the care market. The challenge of the latter being increasingly about pay and job competitiveness in a rapidly changing global economy and a fiercely competitive labour market. Certainty about costs for individuals goes hand in hand with certainty of supply. People need to know how much they will have to spend and what they are going to get for their money. The current reforms potentially offer greater certainty about the former, but they do not yet address a very real existential issue about the latter. People need not only certainty about the money they will have, but also whether there is anything to buy. I've been asked to say a few words about being a trailblazer. So as you may know, North Yorkshire is one of the trailblazer sites for this policy. Now, I think we probably see it as a test site or a pilot site because we're all in the learning phase. And I think, first of all, we welcome that the government is testing out the policy in a number of areas before national rollout. And we very clearly want to be able to bring positive benefits to the people of North Yorkshire, as I think all of us do to all of our residents and customers. We didn't apply to be a trailblazer site, but we welcome the fact that a large rural county is part of it. You know, as you probably guess, things can look very different in somewhere like Whitby compared to Whitehall, and we want to make sure this is rural proofed as well. In terms of the trailblazer, it's early days, but I can assure you that the issues that we're discussing today are very much reflected in our discussions with the other trailblazer sites and with government. From the work that has been done with CCN and Newton, you can see there are some notable concerns. And I think what struck me when I was part of some of the discussions was you got some very different perspectives from different areas of the country. So in lower value housing markets, arguably in what are often called the red wall areas, the care cap was seen as a significant issue. And there were real concerns that despite the promises, some people might still have to sell their homes to pay for care. And then in the larger counties and some of the more affluent London boroughs, there was particular concern about the affordability of Section 18.3 and about care fee harmonisation. And I think across all areas, there is a concern about finding enough workers, as we have heard, to make the reforms a success. And as Rachel has said, we have to assume that the operating model in the future to deliver this will be about customer self-service and a large degree of automation. And that's going to have to be the cornerstone of how the reforms are implemented. So these recommendations resonate very strongly with most of us across the sector, whatever your role. And in fact, I'd probably go further than the recommendations even and say that on workforce, this is not just about social workers and financial assessors, but it's also about the even larger group of frontline workers. There are more frontline workers in social care than there are in the entire NHS. So this is also about them, the people who deliver hands-on care every day in care homes and in home care. Yes, we need and we welcome recruitment campaigns and training. However, I personally think, and I know certainly our local politicians take this view, that we now need an independent national review of the pay and status of care workers that makes care as well regarded and as competitive in today's economy as other sectors too. And I think also a perhaps equally tricky issue is that it raises issues about longer term migration policy. The NHS can recruit internationally. There's a temporary change to policy for the care sector, but really we need to think long and hard about how the care sector can recruit to get the skills that it needs. Appreciate these are two very difficult areas of public policy. They're not easily resolved, but they are issues that we need to start talking about. And I'd also argue that we need to look further at the interface between these reforms and what is happening in the NHS. The NHS is an increasingly large funder in the care market, and yet it sits outside of the market aspects of these reforms. The rules set out here need also to apply to people funded by the NHS. Otherwise, there is a real danger of a further spiralling of costs. I want to finish on a positive note. The Care Act is a really good piece of legislation. At its best, it will help people to live their best lives. It combines the universal and the... It's absolutely right. However, as other speakers have said, landing them well requires time, people, and money. Thank you.
Richard, thank you very much indeed. So just in summary then, what we've heard from Danny is an overview of the research that built on the original Lang-Buisson work from earlier this year. We've seen the financial pressures that are coming from some of the changes, whether it's the change on the cap on care costs, rather, the issues in terms of the fair cost of care, the means test changes, Section 18.3 and access to a council cost of care effectively. We've also heard a lot, particularly from Rachel and from Richard, about how we access the staff that are going to be required to do this work. And my first question is going to be to Danny about have we really captured all of the staff that's required on that. We've heard the provider's point of view in terms of the overall shortage of care staff there are within the overall economy, not just within local councils themselves. And a point just to again emphasize from Danny's presentation is the regional variation as well. And a lot of that goes back to the proportion of self-funders, which varies significantly across the country and is obviously higher in the more rural areas. And therefore the impact will be significantly greater in those areas in terms of some of those cost pressures as the self-funders move from being self-funders paying the higher rates currently today to accessing council care at the new fair cost of care. So some really big dynamic changes here. So again, we're not saying that change in the social care sector is not required. I think everybody agrees it does have a need to change quite significantly. It's how it changes and the speed at which it changes, and in particular, whether it's funded properly so that this can be implemented successfully. So having said all that, there's a large number of questions that come in. I'm going to try and field some of them from the chat bar. If I can start by going to Danny and saying, Danny, one of the earliest questions we got was about actually whether we've covered adequately the staff that are required to do this. It's not just the frontline assessors, but actually all the people behind them that actually make it work. Maybe you could just respond to that.
Thanks, Martin. And probably the short and honest answer is no, we haven't fully looked at all of the different roles in all of this. I think recognising it's such different models at local level, we felt that would be sort of a step too far from the numbers that we provided. However, those numbers are intended to be a starting point for local systems to then go and build upon. So understanding the increase in workload for those two key staff groups, we hope then provides a resource to then say, based on how things are delivered locally, what some of the wider requirements might be. But I think we fully acknowledge we haven't, there are areas in this which are not exhaustive. There are another couple mentioned in the chat as well. So I think, yeah, we try to state those clearly in the report so that locally colleagues can explore how to fill some of those gaps.
Yeah, thanks, Danny. If anyone else wants to come in from the panel, please do so. If not, I'm going to move on to the next question, which is, I've got an anonymous attendee. Is there a role for providers in undertaking assessments for lower level needs if it's not possible to recruit the social workers? And maybe, Nadja, you might be a good person to at least answer that one, at least start to answer.
Thank you, Martin. I did look at that question and I thought, I'm not sure I'm not sure the providers have the capacity at the moment with the way things are, and they would need substantial amounts of training in order to do that. And also the conflict of interest question might come in. I think I'd be really worried about that so trying not to be negative. I think there needs to be a role for providers to be able to give the right information, but it would need to be very, very much on the basis of it not being seen as, leading people, because I think that the confusion around this is going to be substantial for the public. And I think that's already been talked about. So from my perspective, I don't want to think some providers might be really good at it because they've got a good, back office movement, but there's single providers out there. So we don't want to be putting additional pressures or burdens on them. But the conflict of interest thing would be the one that would worry me probably.
Yeah, I don't know if anybody else wants to comment on that. Maybe Rachel?
Yeah, so I think what we're going to have to get to is a trusted assessor model, which I think is probably the intention of the question perhaps. And and often, you know, we do consider that in terms of the residential and nursing sector. But as Nada says, we know we've got similar capacity issues in that part of our world. So my view would be, what different forms of assessment in terms of the individuals who do assessment can we develop with the kind of thinking around trusted assessor model, so that we've got a shared understanding of what that assessment is, we get the right inputs in terms of the information to get the right service for the individual. But I do think we're going to have to massively extend and expand the volume of people, ideally, as well as machines that do assessment. But Richard will have a much clearer view because he's much closer to it than I am.
Yeah, and Richard, just before you come in, can I just also sort of advocate, one of the problems I think is that we're dealing with people here who won't necessarily be terribly technically literate, you know, so, you know, you can't make the assumption that these people would all have internet access. You can't make the assumption that all be keyboard savvy, and that they can answer quite complicated assessments online without necessarily talking it through with a real individual. So having acted as sort of devil's advocate on this, Richard, what's your view?
Okay, well, I'm sorry to disappoint. I haven't got all the answers on this, so I must try harder. I think that the truth is somewhere between, and I agree with the points that all three of you are making. Actually, I live and work in a place where most of the care providers are small family businesses, and I simply haven't got the capacity to take on, responsibility for huge numbers of assessment. And I think also we just need to remember that providers aren't sort of passive in this. They do provide very skilled assessment already. They have to, we're talking about people's homes often, that requires careful thought. That does require assessment about the mix of people, the quality, how things will work, the dynamics in a home. So I would argue actually providers are already doing assessment. It's just not the transactional financial assessment here that we're talking about. I'd agree with Rachel. We need to think about what trusted assessment will involve. That term is often bandied around, particularly with the NHS, and it's had a mixed history. So I think there's something about how we think about that. I think for me, there has to be something about automation. And I agree with you, Martin. I think there is an issue. Often people may not be as tech savvy, but often friends and family can help. And I think there is something about wraparound services that we can help people to work through the system. I think there's also a danger that it is incredibly complicated. But one of my colleagues the other day was saying we need to try and make this as simple as possible. So if I think in my own head, we have an account for the council, and you can, have your library books, and you can do other things online through that. For me, there's maybe a single care account rather than two care accounts, and you channel that according to people's changing life circumstances. I think there's a danger we could make this hellishly complicated, and we replace one very fragmented, complicated system with another one. So it requires a bit of thought to get to that. But there's absolutely something about the new workforce and what we need to do, the roles here.
Yeah, thanks, Richard. There's a question that probably slightly outside our purview here, which is about the cost of living crisis. But can I just put the question in slightly different terms, maybe to Danny and to Nadra, which is a lot of this work's been done up until the real pressure in terms of cost of living is coming through. And I wonder to what extent we can factor in, when we go back to government, some of the new pressures that are rapidly building up in terms of energy costs, food costs, and so on, which I suspect will rapidly increase the actual real cost that this is going to be to both the providers and indeed via them back into local government. And I don't know, Danny, whether maybe I could start with you and then maybe over to Nadra.
No, thanks, Martin. I think it's a really important question, and we should say clearly, particularly the fair cost of care analysis, of which key components clearly are going to be heavily influenced by salaries of staff, along with the operational costs of running those businesses, which are all going to be massively affected. I think that analysis predates effectively this sort of crisis, and likewise the sort of forward projections. We've built in a relatively standard 3% inflation, so there is a requirement, I think, to as you say, Martin, when we make as we're making this argument to government to make sure that is accounted for. I think there's and again, particularly when we look at the workforce challenges and how we find those some of those additional staff who are going to be required. I think recognizing again that we were already in a sort of position of arguably inadequate reward and recognition for those people, that gap is getting bigger and bigger all the time. And I think so. I think that's a really important point to make and emphasise. And I would just say, yeah, the analysis as it stands, as you rightly say, kind of predates that. So that's additional impetus, I think, to add on top.
Yeah, Nadra, I don't know if you have a view on that.
I mean, I think I would agree that it's a serious consideration, and I think month on month we're beginning to see the pressures much more on providers, and we can see what will happen as we go forward. And for example, the PPE comes to an end. You know, all of those are going to be additional pressures, cost pressures on providers. Some of the things that are completely out of our control, which includes things like insurances. If we're not able to put that into any calculation that might come out with a model that would be more realistic, then we're actually starting on the back foot already. And I think that is an enormous challenge for providers at the moment, because as we're filling in these kind of these tools that are coming out, we're being told it's got to be based on, you know, last year's accounts and what you've done. Well, that actually doesn't take us forward in any way, especially as we look at the cost of living crisis. And so we are hearing much more, especially from the SME sector, more and more providers kind of saying we're just thinking about selling. And I think that's a little bit of a worry that we've got to face as we go forward.
Thanks, Nadra. There's a question here from Mark Howe, and it's more of actually, it's not a question, it's a statement. Maybe I can just turn it into a bit of a question, though, which is about the deliverability, first of all, of the staffing. There's an assumption, or a conclusion, if you like, that's coming from Danny's work about the number of extra staff that's going to be required. We've already heard that may be an understatement, because actually the number of supporting staff may not have been adequately taken into account, which is fair enough. I guess my question to both Richard and to Rachel is, how solvable is that as a problem? I mean, can we actually recruit the number of staff, even taking into account the automation of some of the self-assessment that Richard and Rachel just talked about? You know, is there a way of solving this problem, or are we actually heading towards what's described in Mark's comment as a catastrophic impact on the whole system? Richard, maybe you first, then over to Rachel.
Yeah, I mean, we'll have different perspectives from different parts of the country as well, but to be honest, I've never known anything like it. So I've been a DAS for 16 years now, and in different parts of the country, and I've never known such a fiercely competitive labour market. And I think that's, you know, in some places that's for social workers, occupational therapists. Everywhere it's for care workers, whether it's in home care or residential and nursing homes. And I think that's a number of things. People try and pinpoint it on one thing or the other. You know, clearly COVID has had effect. Clearly, changes in our relationships with Europe and with sort of, you know, migration policy have an impact. And just actually recognize the sector is losing its competitiveness with other sectors. So it's struggling to keep up with the NHS. Agenda for Change can offer better rates of pay for people, better pensions. Simply actually getting the NHS to employ more people doesn't necessarily open the supply lines. It takes people largely from the social care sector. So we need something above and beyond that. And we're experiencing the things that we're seeing, I think, around the country with retail, hospitality, logistics. The economy is going through, I think, I would argue, a fundamental readjustment. You know, is it a 3 to 5 year cycle at least? And that is going to be a huge challenge. You know, I'm probably even more worried about frontline care workers than I am about having people to do assessments for these reforms, to be honest, because we will try and find a way through doing the assessments, but actually at the end of the day, if those lead to people needing care services and there aren't workers there to provide care, that's a very different story, and it changes the relationship between individuals and families and the state, and that's quite a fundamental issue for us, I think.
Thanks, Richard. Rachel, maybe a perspective from the Southeast as well, because the Southeast labour market, we all know, is very, very tight at the moment. What's your view? Can we actually find these people, and what do we have to do to find them?
So I suppose my view is we can't do this stuff in the way we've always done it, first of all, because the world's changed too much. The second perspective I've got is it's one of the reasons why we've really got to face into any and all work we can do on prevention, communities doing more for themselves and so on, because we need to slow down the rate at which people need care formal care services, and that becomes increasingly difficult when your budgets are squeezed. And it's one of the reasons for me on the levy that it's really critical that we divert more money more quickly into local government, because we for years have been unable to pay the rate for care that we would like to pay. It's as simple as that. We would all like to pay a lot more for care. It is wrong that you are paid more for stacking the shelves in Aldi, my favourite shop, as you know, Martin, than it is to look after a vulnerable person. It's wrong. And we've let that happen as a society. We've let that happen. We've got to turn that dial, but we've got to be able to have the resource to do it. And my great fear is if we turn away from all the pressure in that area of society, because we're saying actually we're going to have to give all that money to the NHS, we know that because we're the other side of the coin, it will just drive more demand into the NHS, and we don't seem to be able to get ahead of that and think about, you know, what are the strategies we really need to manage not just outcomes for people, which is the most important thing, but the demand that we're facing for statutory services at a high end. Because what we know, and forgive me everybody, because this is a hobby horse of mine, what we know is that there is a continuum, and it starts with people being able to do things for themselves, and it ends with continuing healthcare. And CHC is funded by the NHS. And in the middle of all of that, you've got all sorts of complicated funding arrangements, but the fundamental aim should be keep people as independent as possible for as long as possible. And when you can't do that, properly fund the care services that support them at home, which is better for them and is cheaper for the state. So, you know, I know it's not a straightforward answer to that, but I think, you know, we fundamentally need to recognise that we've not rewarded care services in the way that we ought to have.
No, very good point. And, you know, I know certainly around the Southeast, it's very, very hard to get people.
Oh, yes, and in the Southeast,
I might have mentioned that, in
the Southeast. The situation's difficult everywhere, isn't it? But one of the complexities, and colleagues will be aware of this in the Southeast, is the cost of living's really high as well. So you've got this kind of perfect storm of lots and lots of job vacancies, better paid than the care sector, and market rents that are really high, and mortgages that are really high. So, you know, and you've still got this massive demographic of people who need care. So, you know, again, it's really difficult.
Yeah, and it goes back to things like housing, you know, just the actual cost of either renting a house or potentially purchasing a house is really high. So there's massive problems around this, and actually the ability to recruit people. There's an issue also, if I just build on Mark Howe's question, around what the impact might be across other aspects of local government work. So, you know, if this is underfunded, and the work that Dan has done tends to indicate that this is potentially underfunded, is this going to mean either that we actually have catastrophic failure and breach of statutory duties in the social care world, or will it mean that councils have to fund this effectively from other services? So fewer potholes filled, less pavements repaired, you know, schools get less support and so on. You know, what do we see as being the pressures that build up as a result of this? So maybe I could just ask Danny on that, whether he's got a view, then go to Richard and Rachel, and Nadra, if you have a view as well. So Danny.
Thanks, Martin. And I think there's two, I mean, in some ways, it's a bit of a perfect storm, isn't it? Because we've got social care assurance coming down the line, haven't we? And we know that over the next sort of from next year, everyone will get a rate. You know, we'll have a rating as we do for children's services currently. So there's going to be real pressure on that. You know, the comment you made around, you know, unmet need. You know, we already know the good work that ADAS did around the 500,000 people waiting for some form of review or assessment. So, you know, and I think just, you know, from a moral perspective, I don't think any of us would want to go towards a situation where we've got any more unmet need. So I think there's a real pressure there. But then I think a number of conversations we've had through pulling this report together is I think a lot of authorities are really struggling to come to terms with the idea of diverting more of the budget away from other activity towards social care, because I think, you know, I think we know that's been a trend for a number of years, and I think. So that's the feedback we got through this engagement, was people are finding that really, really hard to come to terms with locally. So I suppose a short answer, Martin, I don't really know which of those two things will win out in terms of, you know, the risk around unmet need, particularly with assurance kind of coming down the line, versus that sort of reticence to redistribute more of the existing funding.
Thanks, Danny. Richard, view, are we going to bankrupt councils? Are we going to fail statutory duties, or do we just not mend the roads?
I think there are some real challenges here, and it's back to the points Rachel's made, just about how much you can get from this single pot, really, without proper funding. Local government, I think over the last 20 years has probably shown greater efficiency, greater productivity, and greater ability to make savings, even when against the wall, than probably any other sector. And I think there's sort of independent evidence of that. So we have a track record of really pushing value for money, but there is a finite limit to that. How far can you go with that? And I think there is you and Rachel have raised it, Martin, prevention is absolutely fundamental here. So authorities like mine, and I'm sure like many of the others here, have spent a lot of time and effort on investing in prevention to stop people needing early onset care. So, we've used public health grant to do work to keep people active in their communities. We've invested in housing, extra care housing, 28 schemes just here in North Yorkshire, technology, leisure. All of those things keep people fit and well, and they keep them from needing more complicated, more expensive interventions. But there's a real challenge when, there is a limit to the money. So I'm not here to say I want a bigger budget and I want less spent on leisure and housing. They're absolutely vital to successful, thriving lives for individuals. But it does reach a real question about the long-term viability of all this funding. The other issue I just make around social care funding in particular is it is incredibly fragmented. There are about 7 or 8 different funding sources for social care. We have to sort of effectively beg the NHS for some funding. There are multiple streams through charges and different forms of taxation. It really needs fundamental reform. And that, part of a comprehensive long-term plan has to be a more transparent, clearer way of funding social care in the long term that's equitable for people and fair actually for councils and providers too.
Thanks, Richard. So, Rachel, over to you. And just, the question in the short term is, how do we fund this as local government if there is a gap? I think everything here points to the fact there is a gap. But also, one of the comments just coming up in the Q&A is, in the medium term, we're meant to be seeing after 3 years this 12 billion that's currently going into the NHS backlog coming back to social care. How much confidence, Rachel, do you have that 12 billion will ever come back to social care?
Oh, what a leading question. So first of all, ultimately we'll cut our cloth because we always do. Secondly, I think we've got to be very, very confident with government on that doctrine of unfunded burdens principle. We need to confidently talk about that as a sector. Providers need to come alongside us and do that because it's in everybody's interest. Thirdly, that point about cutting other services, we remember the Barnett graph of doom, don't we? And that sense of, before very long, the only thing that will get any funding will be children's services, adult services, and a little bit on the statutory roads bit. Now, it's hard to imagine anybody feeling all right with that, because as we know, we've got a situation generally in every council where 60-65% of the budget provides services for about 5 to 7% of the population. Now, how is that all right? So, don't get me wrong, absolute cheerleader for adult social care, but the truth is we've got a plurality of services, statutory requirements and non-statutory requirements that make a place successful, make a place vibrant, and drive the economy that pays for the services. So, I think the budget in the round has got to be considered. So am I confident about whether that money will come over? No, I'm not. I've never seen money come back out of the NHS, and unfortunately, when you've been around a long time and you remember stuff, what is now the BCF was originally started life as something called the Integrated Transformation Fund, and the principle of that, and Richard's nodding because he'll remember as well, the principle of the ITF as it then was that the whole amount was a way of getting money into local government from the NHS when austerity came, because there was a recognition that that was going to be really problematic for local government and would impact on the NHS. And before it was even launched, it turned into the BCF, which was a shared funding arrangement. So we do need to have a really honest conversation with ourselves nationally. National government needs to have an honest conversation about the two sides of the coin issue, because it's no good constantly pouring money into the NHS if effectively we're doing nothing around demand. that's to say nothing of the virtuous nature of adult care, of course.
Rachel, thanks. Nadja, how confident are you we can get the money out from the NHS at the end of 3 years to help pay your providers? Oh, you're on mute, by the way. Happens to us all.
I'm totally confident that we won't get it. So I just feel it just feels like a bit of deja vu. I think Rachel just said exactly what I would be thinking. I think the other thing I just want to pick up on just very quickly is that the unmet need, the biggest challenge will be to the NHS, because as needs are not met, and people become frailer, and waiting for that, they end up in hospital. And that is something that is the consequence of not being able to do the assessments in time. But I'm not confident at all that we will get any money. So the only certainty in all of that is that I'm certain we probably won't.
Trust me, I'm not going to run a sweepstake on this. Richard, your hand's still up. Did you want to come back in?
Yeah, if I could just briefly, reflections on the NHS. So I think there's also a debate, as much as about a shift from the NHS, it's a shift within the NHS. So we know that actually, the ageing well, another investment is welcome, but actually that needs to increase quite significantly. I think if you look at the data going back 20 years, there's been a further increase in acute spend and a diminishing of community and primary care spend. That's absolutely vital. That helps us do our job. And actually, again, Rachel and I have been talking about it feels like a bit of reminiscence really, but about intermediate care. That was a good model. It can work. It works in some parts of the country, but actually we need a renewed focus on that. So it's a shift within the NHS. And I think the other thing the NHS can do to help is take it particularly its nursing and its recruitment roles more into working jointly with care providers and councils, particularly thinking about international recruitment, but also bursaries and support for nurses in the sector, I think would be really helpful. Some of the best providers, NHS providers, are doing that, but I think there's more to go at there. It doesn't solve the problem, but it will help.
Richard, thanks. We're beginning to run out of time now, so can I just ask one last question to everybody, and then I'm going to ask you each if you just do a very brief summary before we close from each of your individual perspectives. There's a sort of double question I've bracketed together about there's some really key conclusions and messages coming out from the work that Danny and his team have done in partnership with us at CCN. What communication will be going out in terms of key messages and information to other chief executives? But also, what messages and narrative can we give which those chief executives can in turn use to discuss with ICS partners in the NHS. The ICSs are being formed around the country. They have a responsibility for the integration of health and social care. It's really important that that dialogue begins with those bodies. So if you like, what communication is planned on that? So out to other chief executives and also via them to ICS and NHS partners. Rachel, maybe I can start with you on that, and then I'll come around each of the panel in turn.
Yeah, sure. So on chief execs, as part of the arrangements we've got in place through CCN, there will be briefings around the content of this and the circulation of the report. I think that the other issue for us, and our CCN colleagues might get cross with me for saying this, I do think we need to make sure that this issue is well understood by all the Solace chief execs, because although we've commissioned this at a county level, it is an issue for every council in the country. So we just need to make sure that we share with Solace and we share with ADAS to ensure that we've got as wide an audience as possible. In relation to the NHS, I mean, I think ultimately that will be for local systems to agree, but my sense would be it would be helpful to have an item on the agenda for health and wellbeing boards, potentially for HOSC meetings, for informal discussion, so that this issue is properly understood. In our system, for instance, we took a presentation which was led by our DAS Jill Quinton into our ICS gang to walk them through the scale of the change and some of the issues. And I think it's fair to say that none of our NHS providers had understood what was coming down the track. And of course, there will be resonance for them in all sorts of ways from those changes. Thanks, Martin.
Thanks, Rachel. Richard, back to you, then to Danny, then to Nadra. And I'm going to ask you, if you wouldn't mind, Richard, as we go around, maybe you could just answer that question, but also maybe just say anything you want to in summary from your perspective. Same to Danny, same to Nadra. A lot of the questions, can I just say, that I've been looking at on the question and answer bar are quite technical. So rather than ask those questions now, I mean, Danny would have access to all of those questions. And Danny, you may want to sort of just take that into account in terms of the way we post the information, if they're particularly technical ones, rather than, if you like, take up a big amount of time now on answering that. So Richard, over to you, response on that question, and then any final words you want to add.
So quickly on the comms, I agree with what Rachel said. I think part of the NHS stuff is local place boards, health and wellbeing boards, chief execs. If I give the example of Yorkshire, we've got a lead chief exec across Yorkshire who's reporting into the other chief execs. So we're working together there. Comms and work with providers important. So for example, I'm doing sessions with care providers very shortly. So lots we can do on that score. In terms of key messages from me, so first of all, the reforms are welcome. They are the right thing to do. The devil is in the detail, however, and they need funding and time and proper implementation. And alongside that, they need to go hand in hand with reform and stabilisation of the care market. The two go together. They're absolutely linked. So that would be my ask, really, and my key message.
Richard, thank you very much. Actually, if I go to Nadra next, if that's okay, then finally, Danny, to yourself in terms of the overall summary and wrap up. Nadra. And you're on mute.
I'm doing it again and again today, sorry. I think it's the communication strands are key, because for the sector providers who may have to be dealing with this at the front line, there may not be angles in there that we can actually access. So from any briefings that are coming through, I think it's really important that every local authority has a responsibility to make sure they've got a communication methodology that is about this and how this will develop and how this will impact, I suppose. So for me, the comms needs to come from the leadership of the LAs, but that is heavily reliant on the belief that there is a partnership arrangement, because there's no point doing unto. There is more about a collaborative working environment. And I think the key message out of all of this has got to be that we know what the barriers are. We know what the barriers are to success. We want the reform, but we can see the challenges that are there. What we've got to really do is work as a unified system to enable this to happen. Whether that is about staged implementation or not, use the resources, you know, and if like the question that was asked about, you know, the providers, how can they support? If there is a way, there's a methodology, then reach out, because I think that's the only way we will make it happen. Something's got to happen, because we've got to get to the models that we want to. But actually, the barriers are there. How do we get rid of the barriers?
Nadra, thank you very much. So, Danny, any final thoughts either on that question or alternatively, how you'd like to sort of summarize things? But one of the key themes that's coming through, and I've just been scrolling through the Q&A bar, is about communications. You know, there's an awful lot here about getting some of those key messages from your work distilled into some real nuggets that chief executives, but also the care providers, I think we're looking at a whole sector approach to this, can really start to get out there, both in terms of engagement with government, but also in terms of communication to the public, so that they understand the implications of this. And in fact, that, you know, this is not going to be a silver bullet that solves all problems. And in fact, in many cases, will raise more stress and concern, because people will think it's solved when it's not. Danny, back to you.
I think so the point around communication, I completely agree. Rachel touched on the chief executive briefings. We've got workshops with directors of social care as well, and we are very open to all and other opportunities to distill this, share it, communicate it. So I would sort of encourage anyone to sort of contact us, or obviously via CCN as well, because we want to sort of support that messaging as best we possibly can over and above what's already been planned. Just in terms of quick sort of final point, I suppose I just wanted to emphasise that, you know, there are I think a lot of what we heard today hopefully is around some of the opportunities that this presents as well. And I think Glenn posted a good question in the chat around this, and all the things we've discussed in terms of continuing to work on prevention and population health approaches, and thinking about increased collaboration and different ways of working with our providers, models of trusted assessment, the role that digital can play, all these things that I think we recognise will help successful implementation of this, are in some ways the things we've been trying to work on and make the best of through recent years, just to deliver from the base of delivering a better quality service. So I think this can provide some impetus for that, but I just would come back to that needs some time to achieve all those things, and the necessary sort of transformation needs time. So, but I just didn't want to lose the sort of the opportunities that are presented, but the fact that it needs proper support.
Danny, thanks very much indeed. We've had a significant number of people on this call. We've had over 170, so thanks to everybody who's joined us for this. So just from our point of view as the County Councils Network, working in partnership obviously with Newton, but also with the care providers through NADRA, it's been hopefully a good communication to you. The piece of work will be on the County Councils Network website. Please take time to access that report. It's very detailed. It will give you an idea not only of the financial pressures that are likely to be building up here. There's a range of different scenarios, looking at different assumptions as well. It will give you an idea of the staffing pressures and the assumptions that have gone behind those. And as Danny has said, if anything, they're an underestimate rather than an overestimate of them. I think one of the things we've majored on in this particular session is the managing of expectations out to the general public, which are likely to be significantly in excess of what's actually able to be delivered. And also the regional variations, which are quite significant across the country. A lot of that detail, again, is contained in the report. I would really urge you to spend a bit of time, access that report, read it. It's well worth the investment of your time if you're involved in either the delivery of care or the provision of care across this sector. Lastly, obviously, the importance of engaging with our colleagues in the NHS via the ICSs as they emerge. And Rachel was mentioning that you may want to bring particular information to your health and wellbeing boards or to your statutory scrutiny committees, which can look at this particular area. And then also maybe you want to engage locally with your members of parliament on this as well. There's a lot in this report, food for thought. I hope you've enjoyed the session. This report is launched today. And obviously, as the County Councils Network, we'll be continuing this engagement with yourselves and indeed with the wider care community. So having said that, I'm going to close this session. Thank you all very much for your attendance. And having said that, session closed.